Hello students, today we are discussing part 2 of parotid gland. In part 1 we discussed about the case scenario of the parotid gland, we discussed about the mumps, we discussed about the features of the parotid gland, external features. Now today we are going to discuss about the part 2. This case scenario you've already seen in part 1. A few of the subheadings will be covering in today's class. Again, the 5 markers and the 3 markers which we saw in the part 1. Now this is a case scenario. A 28-year-old person presented to OPD with history of perspiration. Perspiration means sweating over the parotid region while eating food. He gives history of surgery in the parotid region 1 month back. What is your diagnosis? Actually, this is a symptoms of Frey's syndrome. We'll be discussing it in the next few slides. Anatomical basis for it, again we'll be discussing it later. Discuss the involved structure. In the region of in the parotid region, you have a gland and that is known as parotid gland. So this question is on the parotid gland. Now you can see here, they've asked about the capsule. The external features, capsule already in part 1 we have discussed. External features we have discussed in part 1. Now relations also we have discussed in the last class. Now we are going to discuss about the contents of the parotid gland. Now in this diagram you can see the structures within the parotid gland. Now this is the section of the parotid gland and what structure you are seeing here, that is the parotid gland. Now what actually happens is the structures in the parotid gland from superficial to deep. So from superficial to deep if you go, the first structure you will get is the facial nerve. Then in the intermediate layer you will get the retromandibular vein. Deepest layer you will get the external carotid artery. So these are the structures from superficial to deep aspect of the gland. Now first we will discuss about the vein which is present in the intermediate compartment. So the vein what you are seeing here, this vein is known as retromandibular vein. Let us see how this vein is formed. Now you can see here this vein is formed by this superficial temporal vein. When it joins with the maxillary vein, it becomes retromandibular vein. Now this retromandibular vein will divide into anterior division and the posterior division. So what did we discuss? The superficial temporal vein will join with the maxillary vein. It will become retromandibular vein, which will further divide into anterior division and posterior division. So this is superficial temporal vein. This is maxillary vein. It has become retromandibular vein. This is the anterior division and this is the posterior division. Yes, so that is about the formation of the retromandibular vein, which is the intermediate component of the parotid gland. Several times they have asked the formation of retromandibular vein for a 5 mark and a 3 mark. So you will have to draw this diagram for that question. Facial nerve, this is the superficial most content in the parotid gland. How does this facial nerve come to the face? This facial nerve is actually the 7th cranial nerve. This emerges and comes to the face by passing in between the styloid process and the mastoid process. There is a foramen known as stylomastoid foramen. So our facial nerve will come out of this foramen and then come into the face. Now how does it enter the parotid gland? This facial nerve enters the parotid gland through posteromedial surface. Once it enters the parotid gland via the posteromedial surface, it will divide into temporofacial branch and cervicofacial branch. From the temporofacial we have this temporal branch and the zygomatic branch of the facial nerve. From the cervicofacial branch we have the buccal branch, we have the marginal mandibular branch and cervical branch of the facial nerve. Now you can see here that the facial nerve, where it enters the parotid gland, it actually divides the gland into a large superficial part and a small deeper part. So you can see that the region where the facial nerve entering this part of the parotid gland is known as isthmus of the parotid gland. Now this is also known as Patty's fasciovenous plane. How does it help? Now if any part of the parotid gland has to be removed, it can be removed safely without disturbing the isthmus where facial nerve is present. So that is about the superficial most component, the facial nerve. We are now discussing the accessory process of the parotid gland. Now the parotid gland has so many accessory processes. One such process you are seeing above the parotid duct. This is known as facial process. If you appreciate here, it is in between the zygomatic arch and the parotid duct. So this is known as facial process of the parotid gland. There are several other processes. Now for example, there are several other processes of the parotid gland. You have one such called as pterygoid process. You can appreciate the pterygoid process here. So this is the pterygoid process which is seen in between the ramus of the mandible and medial pterygoid muscle. So the process what you are seeing here, this is the pterygoid process. It's in between the ramus of the mandible and medial pterygoid. Now the process what you're seeing here, this is known as glenoid process. It is in between external acoustic meatus and temporomandibular joint. So that is about the accessory process of parotid gland. Now we are discussing a very important topic, nerve supply of the parotid gland. We will have to discuss the sympathetic component, parasympathetic component. Both these are secretomotor supplied to the parotid gland. So let us first discuss the parasympathetic supply to the parotid gland. Now one point to remember here is the parasympathetic secretomotor fibers, they stimulate the parotid gland and they produce watery secretion from the parotid gland. Let us trace the pathway. Now you are seeing the inferior salivary nucleus here. So that is the inferior salivary nucleus. Our parasympathetic fibers will come out along with the glossopharyngeal nerve. Then they will pass along with the tympanic branch of glossopharyngeal nerve. In the middle ear, they form a plexus that is known as tympanic plexus. From this tympanic plexus emerges a root or nerve that is known as lesser petrosal nerve. This lesser petrosal nerve will enter the foramen ovale here. Once it enters the foramen ovale, it will convey preganglionic fibers to in the otic ganglia. So the ganglia what you are seeing here, that is the otic ganglia. From the otic ganglia, the postganglionic fibers, they will accompany the auriculotemporal nerve and convey the parasympathetic secretomotor fibers to the parotid gland and produce watery secretion. Next, we will see how the sympathetic secretions are produced. Now, in this slide, you are seeing sympathetic supply. This sympathetic, when they stimulate the parotid gland, it brings about mucus-rich sticky secretion from the parotid gland, and they also give vasomotor fibers to the gland. Now, let us see the source of the sympathetic supply. Now, from T1, from the lateral horn of T1, the fibers will reach from the lateral horn of T1, first thoracic spinal segment. They will reach the superior cervical sympathetic ganglia. This is the superior cervical sympathetic ganglia. Now, the postganglionic fibers from this ganglia, it will form a loop around the middle meningeal artery, and then the fibers reach the parotid gland via external carotid artery. They stimulate the parotid gland and bring about the mucus-rich sticky secretion. So, the secretomotor fibers to parotid gland are two types. Parasympathetic will produce watery secretion, whereas sympathetic will produce mucus-rich secretion. Now we will be discussing a very important 5 marker. Now this is the parotid duct. This parotid duct is also known as Stenson's duct. If you can see here, this is the anterior border of the parotid gland. A duct emerging here, that is known as parotid duct. You can appreciate here it is traveling over a muscle, and this muscle is known as masseter muscle. So this duct is around 5 centimeters long, as already discussed. It emerges out of which border of parotid gland? It is the anterior border of the parotid gland. Now it runs on a muscle, that is masseter, which I have already shown you. This is the masseter muscle. We will quickly see the relation of this parotid duct in the next slide. Now you can see the superior relation of the parotid duct. This is the parotid duct what you are seeing here. I'll use another color. So this is the parotid duct. You can see superiorly it is related to the upper buccal nerve, and it is also related to transverse facial artery. Inferiorly it is related to the lower buccal branch. See, this is the lower buccal branch of the facial nerve. So inferior relation already discussed, it is related to lower buccal nerve, and superiorly it is related to transverse facial artery and the upper buccal branch of the facial nerve. Now we have to discuss the course of the parotid duct, extremely important. You can see that this is a parotid gland here. This is the anterior border. Now what actually happens? This is the masseter muscle on which the parotid duct is traveling. It pierces a pad of fat. This is known as buccal fat pad. It pierces this structure, the fat here, which is known as buccal pad of fat. It pierces one more muscle. This muscle is known as buccinator. This muscle is known as buccinator. After piercing this muscle, it travels in the mucosa between the buccinator and the mucous membrane of the oral cavity. Let us see what happens next. So it travels an oblique course and it opens in the mouth opposite the second molar tooth. So this is where it opens. Now in parotid duct, extremely important asked question is the structures pierced by the parotid duct. You already got to know that it pierced the buccal pad of fat, it pierced the buccinator muscle, then it entered into the mucosa of the mouth. It had an oblique course. Now this question is very important. The oblique or the mucosal course of the parotid duct, why it is important? Now this oblique course will act as a valve, and for example, when you blow a balloon, this duct will not get it will not compress, and moreover it will not allow the saliva or any infectious material to reach the parotid gland and bring about infection there. So the oblique course of this duct is very important and it acts as a valve. Now we have our Fraze syndrome, which is very important. How will this patient present to you? The patient will come to you and say, doctor, I had an operation, you operated me on the parotid region last month, and now I've developed a new symptom. Whenever I eat food in the region of the operated region, that is in the parotid region, the skin becomes red, and what happens is I get beads of sweat when I eat something. This is the symptoms which is told by a patient with Fraze syndrome. Now we will see why actually this happens. So you can see this is the normal pathway wherein you have the sympathetic fibers which gives the pseudomotor supply to the sweat gland and also to the secretomotor fibers to the parotid gland. Now this is our great auricular nerve here which supplying the sensory gland as well as the parotid gland. Now this is a parasympathetic component which will supply the parotid gland. But after an injury or an operation, sometimes what happens is an aberrant communication. So this is an aberrant communication from auriculotemporal nerve which is carrying secretomotor fibers. So from the auriculotemporal nerve which is carrying secretomotor fibers to the parotid gland, an aberrant or abnormal communication grows towards the sweat gland. So what actually happens is when the person is trying to eat food, along with the secretomotor fibers traveling in the auriculotemporal nerve, through this aberrant connection, through this aberrant connection, they will convey their secretomotor fibers to the sweat gland. So therefore what happens is sweat or beads of sweat is produced in the region of the parotid gland. So when the person eats, along with the secretions of the parotid gland, there's also secretions from the sweat gland because of this aberrant connection here. So that is about the anatomy of the Fraze syndrome. Now we have the parotid gland duct or the calculi. There's a procedure called cyanogram to find out the stone in the parotid duct. How will the patient produce to you? A 20-year-old male patient presents to the OPD with a complaint of swelling over the parotid region for the past 2 months. Pain increases during chewing food, especially citrus. Now what happens is when the patient tries to eat citrus food, more of salivation needs to occur. So it will stimulate the parotid gland, but unfortunately there's a stone here which is inhibiting the secretions to pour into the mouth. That is why they'll have severe pain. And why there is pain in the region? We've already discussed in part 1 about the paretidomesenteric fascia, which is extremely tough and unyielding. So you have severe pain if there is swelling in the parotid gland. Now there's something called as Hilton's method of drainage. What is that? Now if this is your parotid gland, you know that there is facial nerve traveling the gland. So if you make a vertical incision, you're going to cut them. So Hilton's method of drainage is you make an horizontal incision near the apex of the gland. So that is the procedure to drain the parotid abscess. Parotid swellings are very painful because of the unyielding nature of paretidomesenteric fascia. We already discussed about the mumps infection. So that's all in today's class. Thank you so much.